So to do a post-frenectomy wound care movement, typically I like to do it after the baby's been fed or when they're in a quiet alert state, not just getting in there by default when they're already crying. And one of our main goals is that we really want to keep the newly freed up lingual tissue from readhering to the floor of the mouth. And typically the act of just feeding alone is not enough to keep maximal separation, and one of the main risks of the procedure is that the tissue often wants to readhere and will sort of get sticky and reattach. So one of our main goals is to keep the tissue separated so that healing is not happening with the sides of the wound, but rather the base of the wound up. So to do that activity, typically I'll have the baby centered, usually, doing some oral motor activities or something the baby enjoys for just a few moments, whatever your feeding therapist or lactation consultant has instructed you to do. And then to stabilize the jaw, I usually find that gloves are not needed. If you have clean washed hands as a parent, that's enough. However, gloves I feel like give a little more traction if you feel like you are slipping and sliding in your baby's mouth. So if you want to try it with gloves, sometimes it gives you a little bit more grip. I typically hold the lower jaw down, and then with another finger I sort of scoop in and I push the tongue sort of back to the throat. And then this motion, any tissue that's gotten sticky through the central area will gently keep it apart. And then you can give the baby a snuggle to kind of soothe them and calm them down. Usually repeating that activity about 3 or 4 times a day, or the prescribed frequency by your treating provider and care team members. Thank you very much.